Our first speaker is Dr. Virginia Mika. Dr. Mika serves as the Vice President, Community Programs of University Health. She oversees the CareLink program, which is the financial assistance program for University Health, and a nationally recognized safety net program for the uninsured. In this role, she directs the daily operations of the program and manages enrollment, contract negotiations, and claims administration. She also oversees several women's health contracts, including Healthy Texas Women, Family Planning, Title X, Title 10, and Title 5. She's also the principal investigator of several federal and state grants. Dr. Mika received a Bachelor of Arts degree from Trinity University, a Master's of Public Health degree from University of Texas Health Science Center at Houston, and her doctorate from the University of Texas at San Antonio. Our next speaker is Nora Silva. Nora Silva is currently the Director for Community Engagement and Population Health at University Health. She manages and oversees CareLink outreach efforts and programs. Additionally, she manages and oversees the implementation of multiple grants, 2 federal grants, one focused on roll-eligible children to Medicare and CHIPS, and the other on women's reproductive health, and 3 state grants focused on colorectal cancer prevention, family services through a home visiting program, and early childhood family support. She serves as a faculty member with Christian Latina Leadership Institute, and she earned her Bachelor's of Health and Wellness promotion from Texas State University and her Master's in Public Administration with a focus on nonprofit management and leadership from the University of Texas in San Antonio. And lastly, we have Alexia Ortiz. She is the program manager for CareLink's Get Fit program, a colorectal cancer screening and prevention program. For the past 3 years, she has led community outreach and education initiatives focused on increasing colorectal cancer screening and improving access to preventative care within Bexar County and Maverick counties. She is passionate about advancing health equity and empowering communities through cancer prevention and awareness. Can you please help me in welcoming our 3 speakers for today?
Well, thank you all for this opportunity to be here today and speak with all of you. We are going to be talking about colorectal cancer screening and prevention. We are all from University Health. Go ahead and go to the next slide, Alexa. We're going to first talk to you a little bit about us, who we are, what we do, a little bit of the background on why we're doing this program, then talk to you about the program, and then share some resources that we have come across as well and would like to offer to you. So first of all, University Health is the safety net health system for Bexar County. We are a comprehensive health system that provides health services to 38 counties in South Texas, so not just limited to Bexar County, but everywhere around. We are a level 1 trauma center for both adults and pediatrics. So all of those, if there's a trauma around, it comes to us. Our health system also has achieved magnet status for, I believe now it's 4 years, maybe even 5 in a row, which is pretty remarkable. We're very proud of that accomplishment. But again, we're here to serve everybody regardless of ability to pay. One of the main programs that University Health has established is the CareLink program. It is a financial assistance program for Bexar County residents and allows people to have access to affordable healthcare services. In order to qualify for CareLink, the person or the household income must be at or below 250% of the current federal poverty guidelines. You have to be a Bexar County resident and not qualify for health insurance. We do often get asked, well, why do you have to be a Bexar County resident? This person lives in Atascosa County, which borders Bexar County, and they need help, or they live in Wilson County and, they need services. Well, in the state of Texas, care for the uninsured is an unfunded state mandate to the county. So every county has to come up with a plan, and there's 200 and I believe 54 counties in Texas. So every single one of them has their own program to help people who do not have health insurance. The state mandates that we have to help people up to 21% of the federal poverty guidelines, but larger counties are able to help people up to that, higher threshold. So Bexar County, Harris County, where Houston is, Parkland up in Dallas County, Austin, so Travis County, are able to help people up to a higher uh, income threshold because we have a larger tax base. And again, this is funded through hospital district taxes usually, in order to get the money to help pay for these health services. All right, so moving on, next slide. So again, a little bit about University Health. Currently, we have one hospital, University Hospital. We also have a women's and children's hospital, and we are opening two community hospitals. So they're opening in 2027. We have our Vertama Hospital over on the north side of San Antonio, up by Vertama, what is it, the track at 35 and 1604. And then we have Palo Alto Hospital on the city's south side, not far from, right by where Texas A&M San Antonio is located. And so those are opening right around the corner. All the plans are, in place to have those up and running. And we're very excited to be able to expand our scope to continue to serve the residents of Bexar County and meet all of their healthcare needs, regardless of where they live in the county, because it just keeps growing. Next slide, Alexa. So our clinics, as you can see, we are spread out throughout the county. So all throughout San Antonio, we have clinics available, and seems like we keep adding. But we do have CareLink enrollment offices at 4 of these clinics. So if anybody that is ever in need of enrolling in CareLink, please have them contact us, and we can get them scheduled at usually a location that's fairly close to them. Our locations are at the Robert B. Greene campus downtown, at the Southwest Clinic over on 36th Street near Highway 90. We have another CareLink office at our Southeast Clinic on Ada Street, so down by 37 South and, oh gosh, what is that? South Cross. So by where McCreeless Mall used to be if you grew up in San Antonio. And then we have another location on Rector, which is right behind North Star Mall. So where we have CareLink offices throughout the city, but we also have online applications available, and where people can complete everything online if they're unable to get to a CareLink office. So that's another possibility. All right, next slide. So switching gears now to talk a little bit about colorectal cancer. So colorectal cancer is the second most common cause of cancer deaths when you look at numbers for men and women and you combine those. And so the American Cancer Society says that, they're expecting about almost 53,000 deaths in 2025 that were caused because of colorectal cancer. But remember, colorectal cancer is screening amenable, which means that it can be detected and treated early, which will lead to better outcomes. So that's why it's super important for us, to work with our community to get screening, make people aware of it, first of all, get them educated about what they need to do, how to do the screenings, and their options, because now there are more options than there were in the past. Also, just I think it's important to note that the death rate from colorectal cancer has been declining, in older adults for several decades. But what we see that's concerning is that in people under 55, death rates have been increasing over the past probably 20 years or 10 years. So if you have kept up with the guidelines for colorectal screening, they dropped the age down to 45, which is seeking to address this concern. So again, something just to keep in mind. Next slide. So talking about some statistics for colorectal cancer in Texas. So if we look at the time span from 2017 through 2021, the incidence rates for Hispanic women was lower, significantly lower than it is for Hispanic men. So women are 29.8, men were at 45.7 per 100,000. And again, death rates for this was again looking at data in 2022 among Texas Hispanics was 16.9 for men and 9.9 for women. So we keep seeing this disparity, right, where Hispanic men have a higher incidence rate and a higher death rate than Hispanic women. Very fortunately, in Bexar County, our CRC death rate among both men and women was 14.3 per 100,000. So lower than the state average, but still, it's a high number that we would like to bring down by early detection and screening. So when we look at screening rates, so Hispanic women tend to be pretty compliant with other cancer screening tests like mammograms and pap smears, but CRC screening rates still remain low at 61% compared to 72% for mammograms and almost 82% for pap tests. Again, when we look from 2014 through 2018, women's CRC incidence rates were higher in Bexar County compared to Hispanic women throughout Texas. So it's, again, kind of interesting to see what's going on with that. And the mortality rate for women in Bexar County was higher, for Hispanic women is higher in Bexar County compared to Hispanic women across Texas. All right, so next slide. When we were looking at applying for this grant, we said, okay, well, what's happening with our careling population specifically? Are they being screened? Are they compliant with screening? Are they, actually completing it, timely? And so we looked first to see how many CareLink members we had that were between the current screening guidelines, so from 45 to 75 years of age. And, as you can see, for men, we had about over 5,000, women nearly 7,000. So we looked at it for both the FIT test and for colonoscopy. But when you look at the numbers that actually completed screening, and Alexa, I think this data was from 2021, if I'm not mistaken, because this was when we were looking at completing the data for the grant. You can see that the compliance rates were very, very low, even compared to, county data, to state data. And so this is where, again, we saw this disparity with our uninsured CareLink members who are not completing CRC screening, even though we know that, they're of age. The average age for a CareLink member is around 45 years old. So we should be seeing a lot more numbers with this. So we saw the need, and that's when we decided to apply for a grant from the Cancer Prevention and Research Institute of Texas. So I will hand it over to Nora to talk a little bit more about some of the other reasons that led us to doing this and to talk about the program.
Thank you, Dr. Mika. We can go, oh, there it is. Thank you, Alexa. So as Dr. Mika mentioned, with our CareLink membership, on any given month, there's probably an average of 24 to 25,000 CareLink members that present with not just the need for healthcare services, but dealing with comorbidities, dealing with transportation issues, low socioeconomic status, so lower education access. And so there's these social or non-medical drivers of health that we really do have to keep in mind when we develop our programs. So again, who is our population? What does the economic instability mean for them? So when we think of, for example, the FIT screening and selecting that as the type of screening that we would do is really based on the need of our population, knowing that whether it's going straight to a colonoscopy, for example, would be more costly. Therefore, we would be able to reach less individuals. And it also costs individuals a little bit more, that not just financially, but in terms of time. And we'll talk a little bit more about that in a couple of slides down. But again, we consider the economic instability that our patients often are experiencing. Education access and quality, again, those impact their decision making about what screenings might mean to them and sort of the value that they kind of put in terms of priorities of what to address, especially if they're dealing with other health conditions. Getting a screening for a health condition such as a colonoscopy or a FIT screening or even other types of screenings really comes lower on their list if they're dealing with something significant, that might be chronic and that they need immediate attention. So these are all things, again, that we have to consider when we do the development of the program itself and how we outreach to our population. And again, healthcare access, right? So CareLink is a way for them to begin to access that, but what does that also look like for them long term? And if they're identified with cancer, for example, what does that mean for them long term? So all these issues that our community and certainly our CareLink members are impacted by are things that we need to consider when we're developing our program. So if we go to the next slide, there's a couple of other social and non-medical drivers that we consider: the neighborhood and built environment, and again, what they have access to. If we're promoting healthy eating and being physically active is beneficial for people's overall health and wellness. But if they don't have access to that, then it's really part of our program to help them identify that. What other things exist in the community that we can partner with and make those resources available to our CareLink members and our participants for our program. Social and community context, right? All of these social, non-medical drivers of health really do impact the whole person. So we try to keep those in mind when we're developing our resources and our materials and even how we implement the program. So we go to the next slide. These are medically underserved areas that we've highlighted both in Bexar County and Maverick County. And so part of the program was to identify another region outside of Bexar County that would be at least have similar needs, and certainly a medically underserved area that we could partner with as a way of managing the resources of the state through the CPRIT grant, and saying we're not only going to sort of address in our county, but we're going to help another county that maybe have less resources to support them through our grant and to be able to do the same type of work. So we partnered with Maverick due to some other partnerships we'd had with them in the past that were successful. And so again, these are areas that their program that's similar to CareLink, their equivalent of CareLink from Maverick, their health assistance program, and these are the areas that they serve, and same with ours. And while we have CareLink sort of across the county, it's definitely concentrated. A lot of our CareLink members are concentrated in that those areas, the MUA or the medically underserved areas. We can go to the next slide. So as it was mentioned earlier, the CPRIT is a Cancer Prevention and Research Institute of Texas, is who has funded the Get Fit program for us. And oftentimes it can be mistaken for a physical activity when you talk about Get Fit, but FIT stands for Fecal Immunochemical Test. and that's the screening for colorectal cancer. And so we named it that because it's catchy, and so people kind of remember. And the reason, as I mentioned, be the social determinants of health that I mentioned earlier, non-medical drivers of health. Part of why we selected Get Fit is because of those issues that our community can deal with. So getting a fit screening, it's submitting a lab, and so our patient navigators will go through what those steps entail, but it's a much simpler, faster process for our patients. It doesn't take but anything on the personal side for them to collect a sample from a bowel movement and then submit it into a test tube, submit it into the lab, versus a colonoscopy that would take at minimum 2 days worth of prepping, taking time off from work if they work, submitting, going under anesthesia. So not only would it cost more in dollars, it costs more in time. And definitely the time factor is a big one for our community. For them to take 2 days off from work can be much, much more difficult, and much higher chance of them not actually completing that process, even if they've been set up and the schedule is there and the appointment is set, versus a fit. And so our team is really, that's one of the biggest reasons really is why we selected this type of screening. It is for our active CareLink members and members of the Maverick County Financial Assistance Program. And again, with that age switch a few years ago to 45, our age categories of 45 to 75 is that tends to be the higher risk. But again, as already mentioned, that age has gotten younger and younger. I think there's even individuals in their 30s that are now being seen with colorectal cancer. And a lot of that has to do with environmental factors and nutrition, with just the sort of the influx of fast food and high fatty foods in the last 30, 40 years or so, that has really begun to impact the overall health. But for now, this is the age category that's at a high risk. And so we do target this population. And then a fit order is required. So again, part of the process, they do need to see their provider to get that fit order so that we can move forward. And we will say that in terms of the education piece, so that is something that we do community-wide, whether somebody's a CareLink member or not, just to raise awareness for individuals, the importance of getting screening and the importance of sort of recognizing the need to get a screening as well. We can go on to the next slide. So as I mentioned earlier, the fecal immunochemical test, FIT for short, is completed annually. So that is something that our patient navigators are very intentional about, letting our CareLink members know, like, hey, when you do this, just know you're going to need to do it again in a year. Your option, or the sort of the flip side of that, is if you were to do a colonoscopy, if it's negative, typically a provider might say you can come back in 5 to 10 years. But with a FIT test, they do need to do it annually. But once they see the simplicity and how sort of time efficient it is, then they tend to come back. So our team has definitely seen that, where our patients will call them back and say, okay, it's been a year, it's time for me to do it again. And we see that as a big win, because one, people are taking sort of charge of their health and being like they themselves are reminding themselves that, hey, it's time to do it again. So I think in really internalizing the need for them to continue to do the screening is a big win. It's cost effective. Again, one, it costs less, literally in dollars. Therefore, our grant can expand more and reach more individuals. But also in terms of saving the patient time is definitely cost effective as well. And then the convenience of it. So part of what our grant or our team program was laid out is that our patient navigators could pick up the kit and take it, deliver it to the patient, and also be able to pick it up from them and take it to the lab. And that is a factor of the grant that allows it to be really successful, because there are individuals who either lack transportation or lack the time to be able to do that, or really just don't feel comfortable in that clinic, what feels to them very clinical setting of picking up a lab. And the personality, the connection piece, the personal side of connecting with the patient navigator prior to that, typically over the phone, our patient navigators are awesome of kind of building up that relationship, that trust, that comfort, and putting them at ease, so it becomes less awkward to deal and have a conversation about something like colorectal cancer, or collecting poop, for example, and like really using terms that make sense to our community. And the team also utilizes this very kit that's on here. They will use this hat, what they call a hat, to show them what it looks like, what the placement on, a seat, a toilet seat would look like, and what the completion of it, what you do with it afterwards. All of those things is what our patients say is what they appreciate, is what makes it feel, this is doable. I get it. This is not as scary as I envisioned it would be. And I understand now exactly what I need to do. And we always, talk about how early on it was a reminder to all of us, the importance of just having real talk and meeting patients where they're at. Really early on in the process of our grant, we had a patient who asked for clarification and saying, can I take it on public transportation? And our patient said, yeah, absolutely. And she's like, but how would I do that? And they were like, well, you can put the little this little bottle that you see there. You can put it in a Ziploc bag if you'd like, but it's already self-contained. And she was like, but what about? And so she was misunderstanding or understanding that you would need to take her whole sample that was collected in the hat into the lab. And so again, it just truly reminded us how we need to really, we're in the health space, and so we can sort of just think everybody thinks like we're thinking about the steps, but really breaking it down. And so our team again uses everything from tissue paper to show like it falls in here. You put this little bottle, when you open it, there's like a little, think of like a dropper, but it's not a dropper. It looks like almost like a little scrubber. It's small, and they just dip it in. And so showing them every step of the way what that looks like, how you dump out what's in the hat, and how you can then wrap that up in trash and put it in a trash can. Like every one of those steps is super important when we're dealing with our community. It's really part about meeting them where they're at. So I know I spent a lot of time on this one, but this was a big one, so thank you. And then our outreach and education, like this is out. We do mail outs and letters, so we have access to our CareLink members, so we will send out letters, postcards. The month of March, it was Colorectal Cancer Awareness Month, so we definitely send out sort of a highlighted mail out postcard, just reminding them it's time to get screened if you haven't gotten screened in the previous year. Also the importance of getting screened and signs and symptoms they can look out for. We attend community events. Again, our outreach and education in terms of making people aware of the importance of this, we do it anywhere there's an opportunity for us to reach our target audience, whether they're CareLink members or not. And then our clinic outreach, we have, as Dr. Mika showed earlier, a pretty significant sizable map of all of our clinics. So where it makes sense, where our target audience is, we do clinic outreach as well. Alex also does education with our providers to just remind them, hey, this opportunity is here. Definitely send people our way as they need it. And then we do make all of our presentations English and Spanish. We provide them both virtually and in person, all in an effort to really meet people where they're at, and on one-on-one settings if need be. If we have classes certain days and times and somebody's just not able to do that because maybe they have a different work schedule or whatever the reasoning is, whenever possible, our navigators will also do one-on-ones as needed so that they get the education. Ultimately, we try to make sure they get the education before they go through the screening, because another sort of challenge can be that an individual can complete the screening, but if they're not done correctly, then they got to do the whole process again. And the same thing applies for a colonoscopy. If they miss a step or do something incorrectly or not fully as presented to them by their provider, then it could be thrown out and they got to start the process all over again. So our patient navigators are really committed to make sure that our patients know exactly what they need to do so that they get the screening done completely and correctly, and get full accurate results. We can go on to the next slide. I'm trying to think of where we're at with you, Alexa. So our patient navigator team is a bilingual team. We do focus on identifying individuals who have lived experience, particularly maybe not necessarily like with colorectal cancer. That would be super specific, and that's not what we are focused on, but really somebody who understands our community, the needs of our population, the challenges that they might be dealing with outside of their health, with their lives, because we know that relatability and being able to have the compassion for the population that we serve, and not and just again remember that people have different priorities, and so we do are really mindful of our team members really having that lived experience. Again, individualized support. Patient navigators call the patient, talk to them on an individual basis. If there's challenges, for example, there might be a patient who doesn't have, and it's one of the points there, sponsorship. Maybe they don't have anybody in town or somebody that's available to go with them to complete a colonoscopy. Maybe they've had a fit and it was positive. Now they got to go back and complete a full colonoscopy, but they don't have a family member or somebody to go with them. Our patient navigator will work with them to be that sponsor, will be that person that goes with them. And that's key because Alexia will provide some sort of results of our grant thus far, but people will put off completing it if they're not even allowed to have a colonoscopy if they don't have somebody with them for the entire process. Our patients navigators also connect our patients to other services, be it outside of colorectal cancer prevention. We have other grants, we have other internal services through University Health. So just really getting to know the individual and what are the challenges that they're dealing with, what are some things that their family might be dealing with, to try to really be an overall advocate for them. Transportation assistance is part of it as well when needed, particularly for colonoscopies. If they need transportation to and from their appointment. And follow-up care, part of what our team does is if they do have a positive result for either a fit or whether they need to do a colonoscopy, whatever that follow-up is, to stay in touch with the patient, make sure that they've gone through the whole process all the way through the end. We have had a couple of patients that have where polyps were identified. Others were a couple of individuals who did have cancer present. So again, just following the process through getting all of the care that they need. And then building trust. Like I said, a lot of these components are about building trust with the patient, because ultimately they start to feel accountable to our patient navigators, because they kind of have worked together and they kind of see them as their advocate, their coach, they're being navigated by them. And so they are more likely to complete the full screening and doing it correctly. And where are we? All right, I think this is my last slide before I turn it over to Alexia. Some of the challenges that we experience, because it's not just all super easy and simple, right? Some of the challenges is that sometimes our patients just aren't unresponsive. They don't answer the phone. We leave messages. They don't call back. Maybe they do the screening, and they, again, after the screening and not responding. It's things that we work through. Our team meets on a regular basis to talk through and see if there's other ways. We've had different times of the evening, for example, working late evenings to be able to get in touch with people, because sometimes it's that during the day they won't respond, but in the evening they will. Some of our other challenges include just loss to the follow-up care. Like maybe they did complete the screening, but maybe they need to do some more follow-up and they're not responding to that. I mentioned it early on, comorbidities. If they're dealing with something else, if they've been, dealing with diabetes for years and maybe they have an amputation that they're facing, they're not really worried about completing a screening for colorectal cancer at that moment, because they're dealing with something that's more present, sort of that needs immediate attention. The delays in abnormal results review. Sometimes we see that they've gotten an abnormal result, but getting in touch with them to be able to have that conversation with them can be delayed, and then it might be time to them to do it again in order to make sure that it's still accurate. Incorrect preparation for screenings. That's one of the big focuses for our patient navigators, is to make sure that the patient does all of the steps that they need to do for the screenings. But even with that, sometimes there's still a misunderstanding, or sometimes they're like, oh, well, I didn't know you meant the whole thing, or I didn't know this is what you meant when you said this. And so Incorrect preparation for screening would really typically means that they've got to do it again, whether it's a FIT screening or even more so the colonoscopy tends to be a little bit more time consuming, and a little the getting another appointment can take definitely a few weeks versus just sort of taking it the next day like a FIT screening. So the incorrect preparation for screenings can be a real challenge for us, even with all of the support that's provided. And then the physician support and internal barriers are challenges that we had early on. I think we really have overcome a lot of those, because our initial feedback, and we can totally understand it, is why not just let patients know to go straight to a colonoscopy? Why do a FIT screening? But again, once we've been able to show that part of the challenges our patients deal with, like transportation, finances, and understanding the benefits of the screenings, those can be overcome much more easily with a FIT screening, something simple and quick that doesn't require a whole lot of commitment on the patient. It's less invasive. It overcomes that sort of cultural barrier of being embarrassed or even being put under and being afraid to do that. So it really does overcome other barriers. And so I think in more recent years, our internal support from physicians and clinics has definitely been much more positive, and we've been able to demonstrate how effective a FIT screening can be versus giving somebody a colonoscopy order right from the very beginning that doesn't get completed at all. So these are some of the challenges that we have had, and some we've overcome, some we're still working through. So I'll turn it over to Alexa.
Awesome. Thank you, Nora. So just to summarize the Get Fit program, here are some of our highlights when we first started our outreach efforts. So from March 2023 through October 2025. I have a few more updated numbers through February of 2026. So for FIT screenings completed, that updated number, we did do over 2,000, so 2,180 FITs were completed in Bexar and Maverick counties. For colonoscopies, that number did increase to 283 that were completed. That followed a positive FIT screening. Polyps removed 513 from those colonoscopies, so almost double of the colonoscopies completed. So pretty much everybody had at least one polyp found. In our program so far, 2 patients were found with colorectal cancer, early stages. We were able to help navigate them to additional services and surgeries to help remove that, so they are recovering and doing well. And talking about patient support services, really for education, we did educate over 6,000 patients and community members, like Nora was saying, not only CareLink members, but organizations in the community that we've partnered with, some senior centers throughout Bexar County. We were able to educate them on colorectal cancer. Transportation assistance, 591, and this includes, like Nora was mentioning again, sponsorship services, picking up and dropping off FIT kits on behalf of the patient. That's a big component of the patient navigator's responsibilities. When those patients don't have transportation, they don't have a car, we step in and help. So we can drop it off to their house, to their work, wherever need be. Once a patient completes that screening, we can go ahead and pick it back up from them and turn it into the lab. So that's been a key in helping our patients getting screened and completing them. And then sponsorship, 16 patients who didn't have anybody to go with them to the colonoscopy. And as mentioned earlier, if they don't have anybody, they get turned away. So that's, again, where the patient navigators step in and help be that bridge to complete a colonoscopy for our patients. And some Texas community resources for colorectal cancer. So CPRIT as well, who is our funder, they have a program called CONNECT, which stands for Coordinating Center for Colorectal Cancer Screening Across Texas. And this is really a central hub for all Texas CPRIT colorectal cancer programs. So CONNECT seeks to leverage infrastructure and resources to support the expansion of colorectal cancer screenings across the state, so across Texas, with a focus on medically underserved populations. So again, they're really that central hub of resources, of connecting patients throughout various counties in Texas, where their nearest services are, where they can get screened for at low cost or at no cost for colorectal cancer. And here's a map to better show where these CPRIT program grantees are across Texas. It doesn't look like much. I will highlight that each program covers a multitude of counties throughout Texas. So for example, right here, this maroon one, Texas A&M Health, they do cover 23 surrounding counties around here. So a couple including Tyler, Polk, Montgomery, and Lee. So although it doesn't look like Texas is fully being covered, each program grantee does cover a multitude of counties. And like mentioned earlier, we're Bexar County and Maverick County. And then El Paso for West Texas, it covers about 38 counties that cover all of West Texas and then the south border as well. And here again are a couple of CRC programs across Texas, and then the institute, the organization, and some contact information, as well as I can send the links via the chat once I end this presentation. That way you guys can get more information on them. But one big one is called Project 80%, and this is from MD Anderson Cancer Center. They oversee this, and this Project 80% covers a lot of counties, over 60 plus counties in Texas. And they are really targeting uninsured and low income eligible patients. And they also will be offered a free FIT screening to start the process. Some eligibility for this program, they have to have no medical insurance and are considered low income. They are between the ages of 45 and 75, and they don't have any symptoms of colorectal cancer. So no bleeding, no persistent changes in bowel, explained weight loss. They have to be at average risk. And then they don't have inflammatory bowel disease. So these are the eligibility requirements for a patient to participate in Project 80%. The other one is the Central Texas Colorectal Cancer Screening Program. This is overseen by the University of Texas at Austin Dell Medical School, and they cover the following counties: Travis, Burnett, Williamson, Bell, Guadalupe, Gonzales. And again, to the right, it's their contact information of the PI. And this one is focused more on mailed out FIT screenings. They are free as well, but to try and reach more patients, they just mail it out instead of, whereas we're more of a individual one-on-one basis, tailored to the patient. This is more of a general mail out, but they do also provide education and navigation to those diagnostic screenings once a FIT is positive. And then lastly, Success Southwest Coalition for Colon Cancer Screening. This is mainly in El Paso, Texas Tech University Health Science Center in El Paso. And it does, again, that map I just showed you, West Texas, it does cover 25 plus counties over there. And this one as well, it does provide a free FIT screening, provides education, navigation, and no-cost diagnostic testing. And these qualifications as well, participants must be 45 to 75 years old, uninsured or underinsured, and they're not up to date with colorectal cancer screenings, and they must have a Texas address. And then right here, they mentioned the exclusion criteria includes past history of colorectal cancer and blood in the stool. So those are just some resources, again, for across Texas. I will send those links via the chat. That way you guys can click on them and read a little bit more up on them. And just to close out, some patient testimonies that we've gotten over the years that really help paint a better picture of just some of the challenges that our patients have faced. and how our program has really stepped in and helped those barriers. So I'll just read the first one. So there's a lack of information in the public regarding the FIT test. People get nervous because they do not understand what the test is about. For the most part, people are afraid of the unknown when it comes to screening tests. There are myths that are out there in people's circles. What calmed me down about the test is that it's an at-home test. Being in my own space gave me the confidence to complete the test. Another one, I think it's essential to the community that you all have decided to do home screening, and it's going to be effective and less people will die of colorectal cancer because of it. You all are advocating to stop cancer. It's something that can be stopped if it's caught, and y'all are advocating for that. I'm so grateful. And lastly, here's our contact information, Dr. Mika, Nora, and myself. All right.
Excellent.
Thank you,
Thank you.
Really quickly, Joe, can we, there was a question in the chat about
Sure,
how
go ahead.
it's a FIT test. So some of the programs take different approaches. Our approach here is that for a CareLink member, they do have to receive an order from their physician because we want to make sure that they meet the criteria for a FIT screening. So again, not having any symptoms, not having the irritable bowel syndrome and things like that. So that's how somebody here gets it. Some of these other programs that are available throughout the state do a mail. They do kind of mass mailing of FIT tests to anybody who requests one. And then they work individually with those people that screen positive for it. So just wanted to clarify that.
And it looks like she has a follow-up question saying, and they send the orders to you or whichever campus they are under?
They would send them to the lab. Basically, it's a lab order. And so then the FIT is available at the lab, regardless of which lab they go to within University Health, because again, we're talking about CareLink members.
Understood. Okay.
So I guess my question, they have to be in the University Health system. They have to be patients.
Yes, for our program, for the actual completion of a FIT test or possibly colonoscopy, they do have to be a CareLink member.
CareLink member. Okay.
Yes, we are providing education in general about colorectal screening to community members, but then they would need to, go to their own providers to follow through with that. The navigation piece and all of that we're doing is specifically for CareLink members.
Are you open to have your team go to the communities? We can invite your team to go to communities, or how does that work?
Absolutely. If you just reach out to us, Alexa would be your best contact, and let us know. We're happy to go do a presentation about colorectal screening and the importance of it, and what happens, because there's a lot of also misinformation or misunderstanding about what happens during colorectal screening.
And with this, I know there both has runners, but a quick one. And in these potential community sessions, will they be able to sign up for CareLink if they do qualify?
They would need to contact our CareLink Enrollment Center, the team that is focused on the colorectal screening program. That's all that they do. They don't do enrollments. So that's our CareLink enrollment team.
Okay, thank you.
Oh, I see you have your hand raised. Do you have a question?
Yes, sir. Yes, that was a fantastic presentation. I'm sorry I didn't have my camera on. My internet's kind of wonky today, so I wanted to make sure I wasn't lagging. But no, fantastic. And so going off of what Dr. Bloom was asking, so I'm actually in Eagle Pass, so I know you mentioned Maverick County. And so I think, I would love if y'all have availability to kind of host y'all to do a session, or absolutely invite y'all to, we have, there's health fairs and things going on all the time. in Maverick County. So we have Quemado, we have El Indio. If Del Rio is not Maverick County, but if that's part of y'all's area, I have connections there as well. Kind of whatever whatever we can do, but specifically for Eagle Pass and kind of the surrounding. Um, I would like to kind of talk about maybe, offline, but maybe some opportunities that you could come and provide education to at the community level, but also maybe to our CHWs to give them some focused training on telling them about how to kind of take advantage of your services and facility, how to, who they have to contact for that kind of stuff. And then maybe, putting together like a session, um, high risk patient, all that kind of stuff, but just super open to kind of just hearing how we can kind of collaborate to bring it to the community. And I think it'd be something well, I know it's something very important, um, not always talked about very much. And so, because I know it is a little, sensitive and stuff. And so, but no, anything that y'all can do, or if y'all have any ideas, I'm totally open to kind of collaborating and bringing y'all to the area to set up and kind of provide the education or recruitment, whatever y'all need. I think it'd be
That's
wonderful.
that's amazing. We would love to have that conversation and also include Maverick County since they're our partner, to determine best way to do that. Would you be able to send us an email,
Yeah,
one of us, so that way we know how to connect with you and
absolutely.
Yeah, I
get
was
that
gonna say,
set.
Alexa, if you'll put your email in the chat, that way they have the
Or
email to reach
what I'll
out to
do
you.
since there's three of y'all, or I think there's three, I'll just put mine in the email, um, in the chat. I'm sorry, and then that's my I'm with Southwest Border AHEC in Eagle Pass, and so I cover 7 counties in this region. So even branching out would be awesome too. But just whatever, I'm excited because whatever we can do, it's for the betterment of the community. So yeah, just send me an email. We'll get it going. Thank you.
Great. Thank you. Thank you.
Do we have any more questions? We have time for just one or two. Well, Dr. Mika, Nora, and Alexa, thank you so much for the very comprehensive presentation on colorectal cancer. It was very educational and very well done. So thank you so much for providing your expertise and providing your input on for this very important series. Going to conclude right now. We do have another series coming up, our Parenting Teenager series. It's starting next month on the 13th. It will have 6 sessions with experts pertaining to teen development. It's strongly recommended that CHW nurses and other frontline workers uh, should attend this because these speakers will pinpoint these particular topics, recognizing like early signs of stress, risk, and communication breakdown in teens and their caregivers.